Hi, everybody. This is Carol from STS. This is the General Thoracic Database User Group call for July 28th, and we're going to get started here.
Thank you so much for joining today. We're going to go ahead and jump in. It's a couple of minutes. It's 3:32 Eastern Time. So thank you, everyone, for joining today. It is a hot and humid one here in North Carolina, and I hope you guys are enjoying summer thus far. So to start off today, I just wanted to welcome everyone for joining. Thanks to our IQVIA team for joining today. We've got, let's see who we have on with us today. We have from IQVIA, we have Melanie, Joe, Jean, and Steve. From the STS side, we have myself, Carol Crone, Addie Dolan, Emily Comrade, and Ruth Riley from our core group and our GTSD consultant. So thank you everyone for joining today. So to start today off, I'm just going to provide a few STS updates. Then I'm going to turn things over to Carol and Ruth for a overview and an update on the FAQ, how our training manual process will work for the new 5.21.1 training manual. Afterwards, we'll turn things over to IQVIA, and then we will end today's call with our user feedback. So if you have questions or issues with the IQVIA platform that you need addressed, if you could please include your ticket number or case number. Again, please submit your questions via the Q&A function, or you can also, I believe we have the raise hand function utilized, so you can also raise your hand if you need to clarify a question, or if you'd rather just just speak instead of typing in your question via the Q&A. So let's go ahead and get started. Next slide, please. All right, just some important dates real quick. I just wanted to touch on these very briefly. As you're aware, the spring 2021 harvest did close on Friday, July 23rd. Yesterday was the last date to opt out for the spring 2021 harvest. Again, everyone, we did receive the opt-outs, so those were due by close of business yesterday. We are currently accepting data for the fall 2021 harvest. So the 2021 fall harvest is currently scheduled to close on Friday, August the 27th. And again, the opt-out period for that fall 2021 harvest is currently scheduled for close of business on Tuesday, August the 31st. Next slide. We have coming up very soon our 2021 Advances in Quality and Outcomes, a data managers meeting. Just wanted to provide you guys a screenshot. If you go out to the STS website and go out to our AQO data manager meeting page, you'll see here you can view the preliminary agenda, also get some information on pricing, and if you have any questions regarding registration, please feel free to reach out to Amy Kasich. And if you have any questions regarding agendas or education credits, please reach out to Emily Comrade. Next slide, please. And again, just some information, our registration for AQO is set to open tomorrow, Thursday, July 29th. So again, I think Emily is going to put the email address in the chat box, or the link to the website in the chat box for information on AQO and registration. So when you do go to register for AQO, if you're not seeing the option for free registration, please contact us at stsdb@sts.org. Again, if you're not seeing that option for free registration, we'll just need to get, basically, I think that means that we need to get some contact information updated for you on the STS end. So again, if you do go to register and you're not seeing that free registration option, if you could contact us at stsdb@sts.org. Also for AQO this year, we also for the What Data Managers Want to Know session, one of our most popular sessions for AQO. If you have specific questions that you would like to have addressed by the panel, if you could email those to me by September the 15th, we'll get those questions all collated and have the panel have a chance to review those questions prior to AQO, and we can get those answers for you, so and be ready for discussion during our What Data Managers Want to Know session during AQO. And also just wanted to point out, since registration is free this year for AQO, Data managers, attendees will have access to all of the sessions for all databases. So if you currently participate in general thoracic, if you're interested in learning more about adult cardiac or congenital, we really do encourage you to check out the other sessions on the other days for those databases. Be a great opportunity for you to learn more about those other databases and get more information on congenital or adult cardiac if you and your site are interested in participating in those other databases. Next slide, please. For data version 5.21.1, obviously is now live. Surgery dates as of July 1, 2021 must be entered in version 5.21.1. The upgrade webinars were held, I believe back in, I want to say April, I believe. Don't hold me on that date. I'm not exactly 100% sure on that, but all of those upgrade webinars were recorded and are currently posted on the STS website. We do encourage you to go back and review those. The 5.21 data collection form is posted out on the website, as well as the new training manual that was posted yesterday. So the training manual is now available. The data specifications are posted out on the website, software specifications, itemized changes from version 2.4.1 to 5.21.1. I left off the 0.1 there, as well as the change summary document for 5.21.1. Also, we've gotten a couple of questions from a few of the data managers in regards to the new version and the COVID fields. So we will still be collecting the COVID data. The temporary fields are still being used just as they currently shown on the data collection form and the data specifications. We did send out an email to all of the vendors, alerting them, that the COVID variables will be collected under the same pretenses as 2.4.1 and version 5.21.1, and to please update software accordingly. So again, your vendors should be updating their software with those harvest codes accordingly, same as it was done in 2.4.1. So if you have questions about that or when that's going to happen, if you could just reach out directly to your vendor. But again, STS and IQVIA has sent a communication to the vendors, letting them know that those COVID variables will be collected under the same pretenses as they were in 2.4.1 for the new version. Next slide, please. Before we get started with the training manual, before I turn things over to Carol and Ruth for the training manual overview and FAQ update process, I just wanted to take a moment to thank some very important people that made this training manual. Without them, this would not have been possible. So I just want to say thank you to Dr. Fernandez, Dr. Kozauer, Dr. Cedar, Dr. Wormuth, and also to our core group members, Melissa Clark, Katie Finley, Katie Lothrop, Ruth, and of course, Carol Cron. Just please know these people have donated a lot of time and a lot of hours and dedicated so much of their effort to getting this training manual done. So I just wanted to give a special shout out to them and thank you all so very much for the time that you all spent on this training manual and helping to make it happen. So with that, I'm going to turn things over to Carol and Ruth for their portion of the webinar to give you all a preview of the new training manual.
Thanks, Leanne. This is Carol. Hi, everybody. First, I also want to thank Leanne for numerous hours and late Friday nights and early Saturday mornings working on the training manual during her off time to get it done. I want to apologize that it is delayed. That was my fault. I suffered a concussion in late mid-May that was pretty severe, and of course it was right in the middle of working on the training manual, so it put us behind, and I do apologize that it was late. But I hope that you like it and you find it useful, because we put a lot of thought and effort into it. I want to give a quick walkthrough of the training manual and talk. I'll show you the format of it, and then I want to talk specifically on the complication section, which is probably one of the biggest changes to the general thoracic version update. So I'm just gonna make this screen a little bit smaller here, and then I'm gonna pull over my browser, and I'm going to show you a couple things before we get to the training manual. First is the where you're going to find information about AQO. So This is sts.org. When you type sts.org, this is the page you'll land on. The registry information is all under registries, and the first spot you're going to want to click is the STS National Database. You're going to be tempted to want to automatically go click General Thoracic, but I ask that you just take a few minutes to explore this page. There's a lot of very useful information here. The link to the webinar pages here, this is where you'll find the current webinar, the upcoming webinars, and then postings of the previous webinars. General Thoracic is here, and then past GTSD webinars, and a link to our YouTube playlist. We try to keep the quick access ones, the ones that we've recently posted, limited. So we'll be cleaning this up, but all of them will be underneath the GTSD webinar YouTube playlist. And this is where you're going to find the upgrade webinars we started, looks like in early February. I think Leanne said April, but our months have run together in 2021. So we started in early February, and you'll see it labeled as upgrade webinar. This is where you're going to want to start, just to kind of get a walkthrough if you weren't able to attend, or if you just need a refresher on some of the fields or the changes that were implemented. So that's the webinar page, and you'll find the upcoming webinars too. I'm going to click back on STS National Database and scroll down here. If you have an FAQ, this is where you'll find that link to submit a clinical question. Ruth is now managing the FAQ mailbox for General Thoracic. It can take up to 30 days to get a response, so be sure to get those questions in as soon as you can, especially if there's a pending harvest close, so we have enough time to respond back to you. The 30 days is usually a result of tricky questions, or a little bit more complicated questions that we need to go to the surgeons for review and input, which can take some discussion between the surgeons. What's probably most important outside of the webinars on this page is the important resources. This is where you'll find the harvest schedule information for the upcoming harvest close. And this is where you'll also find information on the advances in quality and outcomes, a data managers meeting, otherwise known as AQO. If you click on this link, it will take you to the meetings page, and here you'll be able to find the preliminary agenda. You can add a calendar reminder, and we'll be opening registration tomorrow, and this is where you'll be able to register. So and we do offer continuing education nursing credits and perfusion credits at this time. So that's that for the National Database homepage. And then if I go into General Thoracic, most of you are probably familiar with this and the access data collection resources. You'll find the past versions listed here. Each of these are drop downs, so you'll find the related information underneath each of these versions. This is the most recent version. The training manual, like Leanne said, was posted yesterday. And then we have the various forms of the DCF. We do not have a non-analyzed procedure data collection form, so we ask that you use one data collection form for analyzed and non-analyzed cases, and provide as much information as possible. I wanted to go into the training manual and just give you a quick walkthrough and how this works. We kind of revamped it this year. We wanted to get all of the databases aligned with formatting, just to make it flow better for data managers who are working across multiple databases, and hopefully we've accomplished that somewhat. Depending on your browser, what you'll find is bookmarks. That I'm in, I think I'm in Chrome now. If you click on this little thing over here, you'll see we bookmark, and this is accidental. Those bookmarks weren't supposed to be there, but we bookmarked each of the sections. As FAQs are added in, we will be bookmarking, and Ruth will expand on this in her discussion. We'll be bookmarking those FAQs under the appropriate section. And in addition to providing additional resources for that. This first page, this is the introduction page. Probably all of the links that you'll ever want are provided here. right at the beginning of the training manual. And these will be in each update of the training manual, which will occur monthly. You can click right here to the AQO section. You can click right here to the FAQ mailbox. STS database webinars will take you right to the webinar page. So great information right at the beginning of the training manual. We added some, and I strongly encourage everybody to read through the introduction and the general information at the beginning. This will help you immensely as you start coding these cases for version 5.21. As new FAQs are added in, they will be put in red. Comments will be in green. The new FAQs for the month will be in red. We'll change the ones that were from the previous months to black so you can easily identify the new FAQs in the training manual. On this section, we talk about procedure inclusion. We give a couple case examples. I'm not going to go through these. I'm just showing that they're here and that it's important for you to review this on your own time. Talk about data collection forms, how the training manual is updated, and what to do when you're coding a case. And there's an update available. How do you code it if the update changes something significantly to your coding? Importing data from other data sources. We cover that here, and we talk about the software specifications, how to handle no and unknown versus no and not documented questions, and then values outside of an acceptable range. Again, very important information. This will explain it to you. This example that we used here is looking just at age. This was one of the very few examples that we could find that had a low value that was not 0 and included usual, high, usual, low, and high values. So just to talk through this, values outside of an acceptable range. This whole range from the low value to the high value, it's also going to be included. Here's a snapshot of what age will look like. We have in the data specifications, we list these values. And what it's saying is that anything less than 1, which would be 0, or anything greater than 110 is not allowed. So you need to, if your value is 111, you would need to enter 110 for the high value. If your value was 0, you would need to enter 1 for the low value. This has to do with data analytics and the way the risk model adjustment works. The risk is high at either end. If this was a risk adjusted variable, the risk is high at either end. So 111 versus 110 doesn't impact the risk. It's pretty similar when you look at risk adjustment. Just a few more examples, and then how to handle 30-day mortality and 30-day readmission. And that STS would like you to keep a log of your sources, your data, the date that your assessment occurred, the status of mortality and readmission. And the spreadsheet is fine, an Excel spreadsheet is fine, and you don't have to have charting within the EHR to code these fields. However, if the EHR contradicts what you have in your log, that's going to be an audit issue. But say that you don't know if the patient is alive at 30 days or not, but you can verify, and social media is a great way to verify if somebody is alive. And if you find that person on social media and you can say for sure that they're alive, then that's fine. Put it on your log, and that's how you verified it. STS is just looking for you to have some type of process in place to verify mortality and 30-day readmission status. And then we get down into each of the sections. For each variable we provide, and I want to find one here that has a little bit more information. Probably not in the demographic section, but one second. We could use social security number known. So this is social security number known. We provide sequence, long name, short name, the format, which is text. This categorical value specified by STS means that we're providing the text and the codes for these fields, and these are the only options that are available. So if you see something with a harvest code and it has a value next to it, that's the only thing that's allowed, and these are the only options you can choose. Another example we provide in the training manual are things like, you can see that that's where a patient lives. If the field is text, we'll provide that as well. And if the field is text, fill in the blank, numerical, we provide all of that information, date, format, you'll see that all here. This used to be separate, and I know Leanne included it in the 2.41 training manual. It used to be separate, only available in the data specifications, but we thought it would be easier for you all if you didn't have to switch between documents. Another type of format that I wanted to talk about are things like parent-child relationships. And this is a good example, although it's not used very often in general thoracic. This field at sequence 210, which is clinical trials, we're asking if the case is related to an STS clinical trial, which STS would assign you a code for that trial if it were. You could select if they were, if for whatever reason the patient was part of an STS sponsored clinical trial, you could select whichever trial it was. That code will open up the next field. So we have here that this field, sequence 220, which is Clin Trial PAT ID or Clinical Trial Patient ID, is looking at a parent to become activated. It's looking at the field Clin Trial, which is luckily right above it. And it's looking for a value that is less than or equal to 1, which 1 is none up here and is not missing. So if it is not none and it's not missing, then you would provide the patient ID for the clinical trial. And this is just an example of how parent-child relationships work, and you'll find this in other spots within the data collection from parent-child relationships. And I want to show you, when I talk about parent-child relationships, how to identify them on the data collection form. We usually left align everything. You'll see, even though date of birth, age, and gender, they're just in one line, and that's fine. But when we get down to things where it says, is the patient's race documented, yes or no? You see this next section is indented to the right. That signifies that this is a child to is the patient's race documented. So here we have his patient race documented. I check yes, and then it says, if yes, select all that apply. This field here, race, would open. I know it sounds like a simple concept, but a lot of people do have questions about parent-child relationships, or why can't they get to a specific field when they have that information for the patient. And oftentimes it's because the parent field is answered in a negative way, where it does not allow the child field to open. So I just wanted to talk about that. Same thing, Medicare, you can see here, and then our Medicare options are indented one to the right. Further indentation for children that are included within that, so grandchildren of the parent field. Okay. And then the final thing I think I want to talk about that Ruth, I don't think is going to cover in her talk, is about the post-operative event section. And I can quickly get there, I think, when we scroll down here. And I hope this is helpful. I wasn't quite sure what to talk about, since this isn't it's kind of I'm sure that you all are very familiar with the database and things like that, and have been extracting for a while. In the post-operative section, you'll see that this was revamped from the previous version, and now we're collecting grading. And one example I want to talk about, we'll just talk about pneumonia, which is pneumonia, and this is the short name is in red on the annotated form, and the 3720 is the sequence number. So if the patient has pneumonia post-operatively and meets the criteria that's outlined in the training manual, which I'll show you in a second, you click yes or code yes, and then if yes, then you have to select a grade. And you can see up here grade, and then it says POGRD PNU. This is post-op grade pneumonia. This is the short name for the field post-op grade pneumonia, sequence number 3730. And you'll see 5 choices here, grades 2 through 5, and information that corresponds to each of those post-op grade complications. Grade 2, moderate symptoms, oral intervention, maybe patient received oral antibiotics or antiviral, nothing major happening here, but it was managed. this is probably going to be the least severe pneumonia you would see after a lung procedure or a general thoracic procedure. Grade through grade 3, and each of these grades get a little bit more intense. Grade 3 is invasive intervention indicated. This would be where if the patient gets IV antibiotic, Mezocin or something else, or IV antifungal or IV antiviral is provided to that patient. Grade 4 is, again, a little bit more severe, and this is where there's life-threatening consequences. Perhaps that patient has to go from a telemetry unit or a gen med bed to a ICU bed, or if they went from a tele to an ICU or a gen med to a tele, that's elevation or escalation of care. If that patient was in the ICU and they ended up getting intubated, that's an escalation of care. Or if they had to be put on pressors or some other type of hemodynamic support, we're looking at that as grade 4 urgent intervention, which could be life-threatening consequences if not managed. Grade 5 is death. And I'm going to go back over to the training manual, and we're going to talk about these because we put the general information underneath each of these post-operative complications that have grading associated with them. And we're going to cover this more at AQO, but I know you all are coding now, and I wanted to give you more information because this is a change. So I'm going to go over to the training manual. I'm going to look for pneumonia. One thing I often do when I'm searching the training manual, which has been helpful for me, and perhaps you already have your own ways, is I'm going to look for this specific field, PO grade PNU. So I'm just going to highlight it. I'm right in the PDF. I can highlight and copy in the PDF. And then I'm going to go over to my training manual. I'm going to go to edit and find. And then I'm going to paste that into the find button. And right away it pops up. So I don't have to do all this searching in the training manual. I just use my find feature and I can easily get to that field. So this is that field that corresponds to post-op grade for pneumonia. So we know the patient had pneumonia. Here's the parent's long name, parent short name. Parent value was equal to 1, which means that patient met the criteria for pneumonia and you had coded it appropriately. And then we have these harvest codes that are listed, right? Grade 2 through grade 5. It matches what's on the DCF, which is fine. And then we provide some clarification in here. It just says, and this is going to apply to all of the post-op complications that have grading. And you'll see this information duplicated through the training manual. The reason we duplicated it so often is so you wouldn't have to go to find that information. It's going to be there right when you right where you need it for the fields that it applies to. So we're going to code, it says code the most severe grade of pneumonia the patient developed post-operatively. Minimal grade is a grade 2 for patients diagnosed with pneumonia. And then this general note is located underneath all of the post-op conditions, post-op complications that have grading. And it says grade refer to the severity of adverse events. Otherwise, we call those AEs. The common terminology criteria for adverse events, CTCAE version 5, which is the grading system that we used because we want to align post-op complications as much as we can across multiple databases, not just STS, but multiple other databases, so that when data is looked at, we can say that we're comparing apples to apples. So it says the CTCAE version 5, which is the most recent version, displays grades 1 through 5 for unique clinical descriptions of severity of each adverse event based on these general guidelines. Grade 1 is mild, asymptomatic, mild. Symptoms, clinical diagnosed observation, intervention not indicated. Grade 2, moderate. Grade 3, severe, medically significant, but not immediately life-threatening. Grade 4 is life-threatening consequences, urgent intervention indicated. And grade 5 is death related to the adverse event. So as we said before, we're only capturing grade 2 through 5 for pneumonia. So you won't ever code a grade 1 for pneumonia. It's going to be grade 2 or grade 5. They're going to treat that pneumonia. And then we get down to, well, this provides more information for you. And we provide a link here to quick reference for this document. And you'll see links throughout. You'll see links and diagrams and pictures throughout the training manual, and those are meant for education and to help you while you're abstracting, to kind of learn as you're going, or kind of provoke more questions from you as you're abstracting that we can hopefully help with. And then this note is this note is important. It says not all grades are captured for every adverse event where grading is required. And then if a patient expires, only code grade 5 death if there is clear indication as to the cause of death, including death certificate, which you could use for coding these fields. For patients with multiple postoperative complications who expire, only code 1 grade 5. So you're not going to code multiple grade 5s. And we have, I believe that we have a check in place to where that we won't allow that to happen, or it will give you some type of warning if that does happen. If you are unsure as to the cause of death, check with the surgeon. If there's still doubt, do not code any complication as grade 5, even if that patient expired. So I kind of want to, that's really where I was going. So let's say that you have a patient, they develop pneumonia, and then they develop ARDS. They have respiratory failure, pulmonary embolus, all these things that can go bad in the respiratory system, right? How are you as a data manager who's not at bedside with these patients and not their primary caregiver? How are you going to determine what the primary cause of death was between pneumonia or ARDS or pulmonary embolus or respiratory failure? That's very tricky to do. So that's why you really have to depend upon what's charted as the cause of death by the provider, which will likely be provided on the death certificate. If you have questions about that, then you need to reach out to the surgeon and verify or clarify with the surgeon what the cause of death was, and make sure that that's documented somewhere in the chart by the provider. So in the event that you do get audited, you have documentation to support your coding. I think that's pretty much where what I wanted to talk about. And this was probably the biggest section that I had the most concerns about for the upgrade. I think everything else is covered really well in the training manual. Like I said, use your bookmarks, and I think we do have pictures throughout here, links throughout here. And then we also, for the fields, we have various fields throughout the document, throughout the data collection form, that are underlined blue and underlined in blue. And at the top of the data collection form, we talk about these fields are required for record inclusion. So age, gender, patient's race, admission status, payer, tax ID, surgeon MPI, medical history is all required. If it's not available, code none. The one field where this gets a little tricky is the ECOG score. That's the other thing I want to cover, is the ECOG score. So we have this, it's highlighted in blue, it's included for record inclusion. But what the heck if you don't have an ECOG score? How are you going to code that? And we don't have an option for none. So what we did, and we don't want to make you as the data manager feel that you need to abstract this field. If you don't have a value, we don't want you to assume or make it up. We want the actual value as documented by the provider. So for this field, this is the only field where this applies. We added some language in the training manual, and we worked with IQVIA to ensure that this didn't cause your data not to get into the database. This language was added. It just says this field is highly recommended for record inclusion. If missing data, the entire record will not be excluded from the analysis, but a warning will display. If this data is not available, leave blank and do not assume the answer. So this is the only field that is quote unquote required for analysis, but if you don't have it, will not prevent analysis. So I also wanted you to be aware of that. And I think that's all I'm going to cover, and I hope that was helpful. And I'm going to go back to this now, and I'm going to hand it over to Ruth. And I want to thank everybody. Everybody really worked hard on the training manual, and a special thank you to Katie Lothrop, Katie Finley, and Melissa Clark for your help during the upgrade process, because You really helped me out a lot for this. So I just wanted to say thank you. All right, Ruth, all yours.
Perfect. Thanks, Carol. So I just wanted to cover a few changes to the training manual update process. If you want to go to the next slide. So the decision was made to align the way that the training manuals are updated across the databases. So adult cardiac surgery, general thoracic, and congenital will now follow the same process for FAQs and training manual updates. What that means is that there will now, so these screenshots are taken from adult cardiac because the new GTSD version just came out, so there's no FAQ summary yet. But the next round of updates to the 5.21 training manual will be posted in the training manual itself, as we're used to with GTSD, but an FAQ summary will also be provided every month. When you click on the FAQ summary, it's just that. It's a summary of FAQs by month all the way through the training manual. It grows as each month's FAQs are added. And as Carol mentioned, they'll be bookmarked in the training manual as well if you prefer to still look at them in the training manual. But it's a quick way to just see what was added. If you want to go to the next one. And then as Carol demonstrated in the training manual, the green font are updates from a previous month or general updates to the training manual. The red font is updates from the current month as they post. So again, these examples are taken from adult cardiac, so don't incorporate these into your practice for GTSD, but this is what it'll look like. The update from December 2020 became a green update as time went along, and then the new updates from July are in red. When August updates, the red will be August updates. And then the blue font in the training manual is a lot of hyperlinks. There are so many hyperlinks in the new training manual, and I think they'll be really helpful to everyone. Really, that's a hope. Next slide.
Somebody's phone is buzzing and they may want to put it off of their counter. Sorry.
Oh, no problem. Questions will no longer be inserted into the training manual. Only clarification will be provided. This will hopefully keep the training manual a little bit cleaner, not such lengthy FAQs. And sometimes the questions are confusing. I have to ask for additional information, and it's not possible to post all of the additional information with the update. And so then the questions don't make as much sense. So we'll be just providing clarification summaries. Not all questions will be added into the training manual. I get many more questions than need to be provided to the whole group. Specifically, clinical scenarios often don't apply outside of the or to the broader group, so they will not be included in the training manual, but you will get an answer for you. If you have a question about whether a procedure, a specific procedure that was performed, or if a case needs to be submitted, when you send in your question, if you could include the original operative note in the pathology report, if applicable, that'll just help me answer your question quicker, because I generally am going to ask you for that information before I can answer your question. If you have a pre-op H&P that is relevant, send that along as well. And I think that's it for my updates to the new process.
Great.
We're going to hand it over to
Yeah, thank you, Ruth, Carol. Thank you so much. That was absolutely amazing. I appreciate it so very much. So yeah, Joe, you're up. Your turn.
All right, great. Thank you, everybody, and good afternoon. So we're going to start with a reminder of an update that we did last month on June 26th. So on June 26th, for the risk-adjusted dashboard report, there was an enhancement. So STS 6841, users who opt out of receiving a risk-adjusted report will no longer have an option to view that reporting date range for the results of the opted out harvest. So functionality has been added to the report parameter page, where the reporting period will be hidden from sites who submit an opt-out request to STS. So if you've opted out of a particular report, when you click on the date range drop-down menu, the date range you opted out from will not appear there. So that way you're not seeing date ranges that don't apply for your site. All right, next slide. We have a quick update here. These following updates are targeted for the weekend, this weekend of July 31st. So the first one documented here is a enhancement.
Am I on the?
That's the right one, yes.
I won't hurt my mouse.
So we're good. So for the risk-adjusted dashboard, under the benchmark and legacy reports, under the post-operative events report, STS 6719, the report will display a new entry for anastomotic leak following esophageal surgery, and that is the post-op PROC-AL variable, the sequence number 3350. Those results will now be included in the report following this weekend's update. All right, next slide. A couple of fixes that will be resolved for the missing variable report, STS 6270. The date of last follow-up and mortality status at last follow-up variables are appearing on the MVR for cases where the demographics form is version 2.2 or prior to when those variables were started to be collected. And so we will update the logic so that those don't trigger incorrectly for you. And then on the risk-adjusted dashboard report, STS 6782, the results displayed when you hover your mouse over the bars in the bar charts are not currently matching up with the results in the data table. And so we will bring those in line and correct that in this weekend's update. And I think that was it for issues. The last note here is just to let you know that a list of known issues and enhancements will be posted to the library for your reference, and those should be available to you next Monday on the 2nd. Then just our usual reminder that if you did submit a ticket that we didn't discuss in today's call, rest assured that we are still looking into it and we will follow up with you when we have more information. Otherwise, you are welcome to contact our support team for updates on any submitted issues, or if you have a new issue, feel free to reach out as well.
Great. Thank you so much, Joe. We appreciate it. Okay, let's go through these next couple of slides really quickly. You all are very familiar with these. Again, just the IQVIA support plan, and please include your 5-digit participant ID number when contacting STS and or IQVIA. We have the phone support number here as well as the email for tech support. Next slide. Thank you. Again, here's just a list of resources available to you out on the STS website. So again, we encourage you to check out the STS National Database webpage for all the information. If you cannot find what you need, please feel free to reach out to me directly, and I can help you get the information that that you're needing. Next slide, please. And again, in order to reach out to me, here is my contact information, my direct email, as well as direct phone. Again, for database operational questions regarding your participation agreement, your contacts, anything else, please reach out to us at stsdb@sts.org for database operational questions. If you're not sure who to contact, just reach out to me directly. And again, I'll get you in touch with the appropriate staff. Next slide. And please mark your calendars accordingly. Our next upcoming thoracic webinars. Our next monthly webinar is scheduled for August 11th at 2:30 p.m. Central Time, and our next user group call is scheduled for August 25th at 2:30 Central Time. So again, please be sure to mark your calendars. And as always, marketing will send out emails prior to, I think about a day. I think it cautiously sends them a day in advance of the calls, just as a friendly reminder of the calls coming up. So with that, that's all that I have for today. So we can go ahead and turn things over to you all for your questions. I see we have some questions starting to come in. So let's go ahead and tackle those. We've got about 15 minutes left.
Before we do that, do you want to talk? First of all, I apologize that my screen was so small. I have a large screen and I didn't realize that it was so small. But did Ruth want to answer the first question that she's been getting a lot of FAQs on already?
Oh, yes.
Okay.
So I've gotten several FAQs about why there is not an open option for lymph node dissection in this version. And you will see that under lung cancer resection concomitant procedures, that second one down, plus 32674, still exists. The intent was actually to capture this information under lymph nodes assessed, which I think is sequence 1880 in the lung cancer section, and not for it to be coded as a procedure. 32674 will be removed in the next data version. For now, it's here. So, you know, it is what it is. It's here. But for the open lymphadenectomies, you do not need to code those. It would be collected under sequence 1880, where you select yes to lymph node dissection, and then you go into that detail, like how many lymph nodes at station 3, how many at 4, et cetera. So that I've gotten several questions on that, so I just wanted to provide that clarification. And thank you for scrolling over to 1880.
Yep,
You're welcome.
1880. Thank you. Thanks, Ruth.
Okay.
Thanks, Carol. All right.
And if, sorry, I should say one more thing.
no.
I'm sorry.
Yeah.
If you
No, go ahead.
if you have a case that's not a lung cancer resection that you choose to enter, so for example, if you do a diagnostic wedge resection with a lymphadenectomy and you want to collect that information for internal purposes, the lung cancer section isn't going to pop open, right? Because you're going to say no to that. It was just a diagnostic wedge, not lung cancer. You can always select unlisted lung procedure, unlisted mediastinal procedure, and input you can then input the CPT code for whatever procedure you performed and just follow whatever your institutional preference is for collecting that information for the purposes that you're using the data. Thanks, Lan. Sorry.
Oh no, apologize. You're fine. All right. Let's see. Our first question from Priya: will the COVID cases be excluded from analysis similar to adult cardiac? Carol, I know QMTF has been discussing this. Are there still plans to exclude these COVID cases? I know Dr. Fernandez is going to be providing more information to us soon, but the plan is still to exclude those COVID cases from GTSD, correct?
I believe they are currently being excluded from analysis, and they will continue to be excluded until the surgeon leadership makes a different decision, but they are currently being excluded, yes.
Right. And Linda had a follow-up question. She had wanted to know if there were any plans to add another COVID variable, asking if the patient received a COVID vaccination. Do you know of any discussion on if they're planning on adding a COVID vaccination variable?
I haven't heard any discussion. That's a good question. I haven't heard any discussion on that. I know that the Johnson & Johnson vaccine, that there was some issues with younger, I think it was younger patients who had some cardiac issues after following the vaccination, but that hasn't seemed to be as much of an issue lately after they put the warnings out on it. And nobody's really brought it up to us as a good reason to include that information. If your site is interested in collecting that information, you can always, a couple options is use your EHR to collect that, or you can add in a site specified field through your vendor software. Or if you're a direct data entry participant, you can add that field through the IQVIA platform to your direct data entry site.
Great, thank you. Next question, can we also add unknown to some of the fields? Oops, hold on, my screen jumped. Can we also add unknown to some of the fields, i.e. oral tobacco? You can only choose yes, no, or never. A lot of times we don't know because it is not addressed. And I believe this is actually addressed in the training manual. Actually, I think it's on page 3 where we give further information requiring no and unknown questions. I don't know, Ruth, did you want to address this, or did you just, or Carol, or you okay with me just reciting what it currently says in the TM, or?
Well, I think the field right now says cigarette smoking, and you check it. If you don't know, you don't check it.
Right.
Right?
Correct.
Okay.
Yes. I'm looking, and then also from what I was referring in the training manual on page 3, we have the information on no and unknown questions, and no and not documented questions. So for example, when a history or physical or, consultation exists in the medical record and values are not specifically addressed in the documentation, you would code no. That's, I think it's on page 3. That's just what I was referring, the no and unknown. So
I think
there's,
that's if no and unknown are options. In this case,
right.
Unknown isn't an option, so you would just leave it blank.
Blank. Okay, great. Thank you. Okay. Question from Mary. Why are we required to track 30-day readmission data on the spreadsheet? And that can be tracked through EMR. During the audit process, the readmission will be discoverable in the EMR. Understand, including comment in the abstract read 30-day mortality, but it's not documented in the EMR, and the information came from an outside source. The spreadsheet documentation will be very labor intensive for large volume multi-hospital centers. Will we be able to simply track those cases where readmission or mortality data was not sourced through EMR?
I can take that one.
Mhm.
That's a good question. And the reason why we require that law, or strongly suggest that log if you want to pass your audits for the readmission fields, is because there's no way for us to verify that you actually checked that information. We can verify against the negative that you didn't check it if the patient was readmitted and they were readmitted to your facility or a facility that you have the EHR access to. But if they were readmitted to an outside facility, there's no way that we could say that that was a correct or not correct, or that you captured it correctly. So having a log just helps us do that. And then your last part, would we be able to simply track those cases where readmission or mortality was not sourced through the EHR? And I think that that's fine. If you have documentation in your EHR that says patient, they're at a 30-day follow-up or a 4-week follow-up with their surgeon, and the documentation says that the patient did not have any readmissions during their post-operative course, that's perfectly fine, and that's great to use. Just make sure you include all of that information if you were to get audited. We have to have some way that we know that sites are tracking those cases. And if it's through your own EHR and all of your surgeons are dictating that patients never were readmitted, I think that that's perfectly fine. But I know that most surgeons are not dictating that information. Same thing, you understood the mortality. So I think that's the best advice I can give.
Thank you, Carol. Catherine, vendor software is preventing us from saving cases without certain fields being completed, and stated that STS required them to put the feature in to be certified. This is preventing us from tagging cases or saving while we get pulled to other tasks. Is there a way that we can compromise on this feature? Actually, Carol and I were talking about this earlier, and we are in discussion with Paul. Carol and I were under the impression, we are actually discussing this with IQVIA. There should be a way to save, Carol, I know you and I talked about this, about saving, doing partial data entry and saving a record as incomplete. But again, Carol, Paul, and I will be talking about that this week, just to make sure we're not hampering you guys from doing, what you need to do. Carol, did you want to add anything there?
No, I think you're right on, Leanne, and we know that sites do real-time abstraction and don't have all of those fields that are listed as being an unsafe checker. However, the vendors were told to program it. They don't have all of those fields, and we know that. At least I know when I was abstracting, I would go in and enter first parts of cases, get all their pre-op stuff done, and then they have surgery, go back and enter all that, and then do the 30-day follow-up, and it all happens in steps. So we're aware of that, and this was not the intention of those checks. So we are going to work with Paul and IQVIA to update this, because we can't go 3 years or 2.5 years with the version where you can't save your cases halfway between abstracting them.
Yeah, that was not our intent. So thank you. Let's see, for ECOG, if the physician documents the patient's status but does not assign a score, can the abstractor document the ECOG? Example, patient working full-time without symptoms, assign ECOG 0.
I think probably, and Ruth, you're free to take these questions, but I'm hesitant to take any clinical questions on the webinars without making sure we have time for you to review them and if you need
Right.
surgeon input.
Yeah, I think we need to take this one back.
Yeah, I agree. Thank you. Let's see, from Nancy, will green notations from previous months be retained, or only the one prior month in green?
Anything that is turned green will be retained in green for the life cycle of the training manual.
Thank you, Ruth. All right. When publishing benchmark data received from analyzed reports, are there guidelines that need to be followed? Is the information on the website somewhere? So yes, there are guidelines to using your STS national data. It is out on the STS website. There's a document out there. I don't know if Carol has her, or if Peter, I can share that with you. I can shoot you an email. If you just want to shoot me an email directly, I can give you that link on the guidelines for using your data. Let's see. Mary says, thank you, Carol. I think Anita is getting back to that documentation question. Can you just log on notes section where you found the 30-day mortality?
Yeah, I think that's fine as long as you're able to produce that when you do if you're ever audited, you're able to produce that to the audit company. Sometimes notes on the vendor software don't always print. If you were to print the DCF on the vendor software, sometimes those notes don't always print. So just make sure that you're able to do that and you provide all of that to the auditor in the event that you are audited.
All right, thank you. All right, actually that is perfect timing. It is almost 4:30 Eastern time. That's all the questions that we have. I don't see any more coming in. So thank you everyone for joining today. I greatly appreciate it. It's an excellent webinar. Again, thank you to Carol, Ruth, Melissa, Katie, and the surgeons for working. They worked so very hard on this training manual. We're really excited about it. Again, if you have any questions, clinical questions, submit them via the FAQ, and Ruth will be happy to get those addressed for you. If you have any other questions in general, please just feel free to reach out to me directly. We really hope you guys like the format of this new training manual. We worked very hard on it, and we're super excited about it. So again, mark your calendars, upcoming webinars. Our next monthly webinar is August 11th, and our next user group call is August the 25th. So again, thank you everyone for joining today. I hope you have a great rest of the week, and we'll chat soon. Thanks everyone. Great webinar today. I hope you guys have a great day.